My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
Old cousin. Or the nursing home down the street that takes in grandma. Yeah, funded by Medicaid. But hey, keep drinking those liberal tears, right? Here's the thing. Politics in this country has turned into pro wrestling. Red corner versus blue corner. Everybody's screaming about owning the other side. But when the smoke clears, guess what? You still have a hospital bill with your name on it. And that's why we need to slow down and strip this all the way back. Forget the sound bites, forget the memes. Let's actually look at what Medicaid is before we talk about what these cuts mean.
Medicaid has never been on the chopping block.
I'm not going to vote for Medicaid cuts, benefit cuts.
You will see no cuts in Medicaid payments.
Medicare, Medicaid, none of that stuff is going to be touched.
They talk about Medicaid cuts. Everybody's going to be thrown, according to Democrats, into all these horrible situations. There's only one problem. The word Medicaid is not even in this bill.
Clearly they lied, and I'll give them credit. They're pretty good at it. Now, for the folks still living in that little Delulu land of, but Glen, they didn't actually touch Medicaid, sit down because class is in session. Let's rewind to the beginning where you actually understand what Medicaid is before you let these politicians sell you fairy tales. Medicaid is not some mysterious government piggy bank. It's health coverage. It's how over 75 million Americans, kids, seniors, disabled folks, working class families, actually go see a doctor without ending up bankrupt. It's not just the poor. It's the cashier who works 2 jobs but still can't afford private insurance. It's your grandma in that nursing home. It's the disabled veteran who came back from war. Here's what most people don't get. Most Medicaid recipients are already working. Stocking shelves, driving Ubers, cleaning hotel rooms. They're not freeloaders. They're the people keeping this country moving. Medicaid is the safety net that keeps them standing. So the next time you hear someone say, oh, Medicaid wasn't really touched, they just improved it, just know they're either lying to you or they don't understand the very system they depend on.
You know what I don't get? How you can't work 80 hours a month. People are really losing their minds because that big, beautiful bill got passed today, and I know you liberals and you Democrats is mad as fuck right now. Oh, we're gonna lose our SNAP and our Medicaid. And did you guys even read the fucking bill? No, because you guys don't read. If you cannot work 80 hours a month, which is part-time, then you don't deserve SNAP and you don't deserve Medicaid.
You see, miss, I'm really trying to be respectful here. Nobody's out here protesting the idea of working 80 hours a month. That's not the issue. The issue is, how exactly is someone with a chronic illness supposed to prove they can't clock in? What about the invisible stuff, the illnesses you can't see just by looking at someone? I'd honestly love to know how that paperwork's supposed to work, because it's real easy to point at people and call them lazy bums when you've never walked a single mile in their shoes. Damn. I need to get my assistant Greg because I need more coffee before my blood pressure spikes.
Barack Obama's, they expanded Medicaid to young, healthy adults. And so what the House has done, which I've been advocating for a long time, is if you're a young, healthy adult, you should be working and you shouldn't be getting Medicaid and sitting at home just getting a government check.
Now, I'm a Medicaid provider. So let's say we have a patient. Let's call her Mary. And Mary lives in a rural part of the country, and she works at her local grocery store as a checkout clerk. It's a minimum wage job. It offers no benefits, but she gets her health care through Medicaid. Now, times are hard, and her grocery store got hit particularly hard by tariffs and supply chain issues, so they have to lay Mary off. Now, Mary is scrambling to find a job so that she can stay eligible for Medicaid. But unfortunately, a lot of people in her small town got hit by these layoffs, and there really isn't much work to be had. And the nearest town with work is about a 35-minute drive away, but unfortunately, Mary doesn't have a car. And the public transportation system in her town is particularly dismal. So she keeps trying to find work, but unfortunately during this time she loses access to Medicaid, which means she loses access to her primary care doctor, her specialist, and the ability to get medications. And without those things, Mary's health starts to deteriorate, and she's in and out of her local emergency room with flare-ups of her diseases. And now she's racking up tons of medical debt. As Mary's health continues to decline, she realizes that she can't really stand for prolonged periods of time because of her rheumatoid arthritis, and she realizes that being a checkout clerk is no longer going to work. So she looks for other jobs, more sedentary jobs like a receptionist, but unfortunately a lot of those jobs require prior experience, which Mary doesn't have, so she doesn't get hired for those. She tries to apply for disability and then volunteer and do some community service so she can get access to Medicaid and her health care again. But unfortunately, the process to do this is very bureaucratic. There's tons of red tape. It's confusing, and a lot of it requires access to either a smartphone or the internet, both of which Mary lost access to because when her services got cut off, she couldn't pay the bills. She had to choose between her utilities and food, and Mary chose food. All of this is extraordinarily stressful for Mary, and she's still trying to find work, but she's getting sicker and sicker. And one morning she wakes up and she's really nauseous. She's vomiting. She's got a headache. She's dizzy. She's got chest pain. She's short of breath. She's a little confused. So she calls 911, and the ambulance comes to pick her up to take her to the emergency room. Unfortunately, her local emergency room has closed because it was primarily getting its funding through Medicaid, and with all these Medicaid cuts, they had to shut their doors. So the ambulance is forced to take Mary to an even further emergency room outside of town. But unfortunately, by the time she gets there, she has slipped into a coma. When she gets there, they test her. They find out she has diabetic ketoacidosis from missing her insulin, not by choice. She couldn't afford it. And she winds up in the ICU for a few days, and unfortunately, Mary dies. So let's pause there and have this discussion. So do you guys think that Mary was a freeloader? Do you think that she was just someone who was sitting at home getting a government check, milking the system, or was she a victim of that system? Was she stuck in this vicious, perpetual feedback loop from which she couldn't escape? Were there many systemic and structural issues that were impacting Mary's ability to get care, Mary's ability to get work? Don't let MAGA Republicans gaslight you into thinking that these are just work requirements. They're not Medicaid cuts. They are most certainly Medicaid cuts. We have data to support this. They did this in Arkansas, and when that happened in Arkansas, what happened was 18,000 people lost access to their health care, and it had no impact in employment. What this is going to do is it's going to make millions of people lose their health care. This will make the chronic disease epidemic worse, not better. People are going to get sicker. People are going to die. Rural healthcare systems are going to collapse. That is going to further exacerbate the already existing healthcare disparities, which contribute a lot to our chronic disease epidemic in this country. It's not good. As a physician who accepts Medicaid patients, I'm telling you right now, this is not good. But what can you expect from the pro-life, Make America Healthy Again party? Am I right?
Here's reality. Most Medicaid recipients are already working. They're flipping burgers, stacking Amazon boxes, pulling overnight shifts at nursing homes. Some are working way over 80 hours a month and still qualify because wages are so low and health insurance is so expensive. And for the ones who can't clock in, we're talking about people with chronic illness, parents taking care of disabled kids, seniors in long-term care. Are we really calling them lazy now? But MAGA World loves this fantasy where everyone on Medicaid is some freeloading couch potato. It's a lie designed to make you cheer while they strip the safety net out from under you, without realizing it's the same net holding you and your family up.
They say, how could you support the big, beautiful bill? Oh, I don't know, Karen. Maybe because this is exactly what I voted for. Putting more money back into the pockets of hardworking Americans by not taxing their tips or their overtime. Making sure that my tax dollars don't go to paying for benefits for illegal immigrants that shouldn't even be in this country to begin with. More money to secure the border, paying for the hiring of more ICE agents, increasing the child tax credit because Republicans not only protect babies in the womb, but we support them and families after they're born as well. Defunding Planned Parenthood, no tax on Social Security, and delivering literally the largest tax cut in history for working class Americans. And if that makes the left mad, then good. If it makes the media spiral, even better. Because we are not here to play nice with the people destroying this country. We are here to back policies that actually help real people. That's not radical, it is responsible. And for once, we have a president who is delivering on what they promised. So keep whining. I will keep supporting a president that finally puts America first. You are damn right I support the big, beautiful bill. This is exactly what I voted for.
So no, Susan, this bill doesn't just punish the lazy. It punishes the working poor, the sick, the elderly, and eventually it's going to punish you too. But hey, at least you got to dunk on liberals for 5 minutes, right? All right, the next bedtime story MAGA loves to tell. These cuts are about saving taxpayer dollars. Yeah, sure. Let's play that out. Because when Medicaid gets slashed, people don't magically stop getting sick. They just lose coverage. And you know where they go? Straight to the emergency room, the most expensive place for care. And guess who ends up footing that bill when it goes unpaid? You. Through higher hospital fees, higher insurance premiums, and yes, higher local taxes. So let's cut the nonsense. This bill doesn't save taxpayers money. It shifts the bill from the federal government onto working families, local hospitals, and state budgets that are already stretched thinner than my patients with TikTok conspiracy theories. You can call that fiscal responsibility all you want, but where I come from, that's just moving the tab to someone else's table and pretending dinner was free.
As a physician that takes care of Medicaid patients every single day, I want to talk a little bit about the bill that was passed yesterday, what it could mean for people like my patients, and what it can mean for the overall healthcare system. This bill specifically is going to require Medicaid patients to have strict work and reporting requirements in order to maintain their coverage. Here's what I see every single day. You have people that are recovering from surgery. You have patients with chronic diseases. You have people that are caring for family members that are ill. They just can't go to work to clock in. They can lose their coverage not because they're not willing to work, but because life just isn't sometimes that simple. Here's the biggest part of what you need to understand. If these patients lose coverage, they're not just going to disappear. They'll have to wait until their symptoms get worse, and then they'll show up in the emergency room. Not because they want to, but because that's their only option. That means diseases are going to be caught too late. Patients are not going to have access to the medications they need, and there's going to be preventable emergencies. We already see this, but it's going to become more and more common. Here's the part that most people don't realize. When millions of people lose healthcare coverage, the entire system is going to feel it. So hospitals are going to take on more unpaid care. The costs are going to have to go up. Don't vanish. They show up in higher premiums, in overcrowded emergency departments, and limited resources for everybody. When one group loses access to coverage, we will all feel it eventually. This isn't about politics. This is about people. What we need are policies that are going to strengthen access, support prevention, and value long-term health.
Oh, hey, Democrats! Oh my goodness! Can you believe it? The bill! The bill! All these things would never happen. Donald Trump is lying. Look what I got. I got some liberal tears. Oh man, I'm ready. Ooh, liberal tears, baby. Y'all are so tasty. Ooh, it feels so good to keep winning and drinking your tears. Feels so good. These next 4 years, we're going to be just sipping on liberal tears.
Now, here's the million-dollar question. Why do some MAGA supporters cheer for this stuff? Why clap for a bill that literally takes healthcare away, sometimes from your own family, and then call it a win? It comes down to psychology. 3 big things are at play here.
I'd rather have Trump as a dictator than Biden any day. It's kind of obvious who knows what they're doing. There's no dictatorship with Trump. He cares. He's for America.
Trump wins, will you accept the results?
Of course.
If Kamala wins, will you accept the results?
No.
If you don't like it, don't come here to protest. Don't come if you're uneducated and you don't know what you're talking about.
You would rather they just didn't come here?
I would rather them not come here.
Are you a fan of the First Amendment?
Absolutely. Absolutely. You know, the right to bear arms. Look, this is...
That's not the First Amendment.
No. The Fourth Amendment. But I'm saying...
That's not the Fourth Amendment.
First, tribal loyalty. Politics has turned into a sports game. It's not about whether the policy helps you. It's about whether your team scored a point against the other side. So if owning the libs means grandma loses her nursing home bed, collateral damage. Second, there's survivor bias. You'll hear, well, I worked hard and paid off my bills, so everyone else should too. It's the idea that because you crawled through broken glass, everybody else should crawl too, instead of fixing the glass. That's not fairness, that's just passing on pain. And third, system justification. This one's deep. Psychologists call it the tendency to defend a broken system just because admitting it's broken feels too scary. If you've built your whole identity around believing one politician, one party, one ideology is always right, then even when their policies hurt you, your brain would rather double down than admit you were wrong. So why do they support this bill? Because in their head, it's not about healthcare. It's about identity, pride, and loyalty to the tribe. even if that loyalty comes at the expense of their neighbor's health or their own. Now, you can call that politics, but if you ask me, that's psychology, and it's deadly when it decides who gets to see a doctor. All right, let's strip away the talking points and actually ask who's going to feel the punch from this so-called big, beautiful bill, because spoiler alert, it's not just some imaginary group of lazy freeloaders. It's people you know. It might even be you.
Yeah, see that woman talking about her father getting kicked out of the nursing home? Well, apparently the nursing homes are kicking out their Medicare patients. And she was like, why would they do that? And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill. And she was like, no, that's not it. Yes, it is. I work in skilled nursing. 90% of the residents that are in there, they are Medicare patients. These buildings stay open because of Medicare. They will close down. They will not care for your aging parents and grandparents for free. They will send them home to you. You will have to quit your job and stay home and take care of them. That means you're going to have to be the caregiver for your father, your husband, your kids. You're going to have to quit your job. You're going to do all this on half the income for your household. This economy is going to suffer greatly when these places start closing down. This is one of the reasons, this is the main reason why I did not want to rely on the U.S. for my income while I'm living abroad. The economy here is bound to crash. When you cut Medicare like that and these places close, a lot of people are going to lose their jobs. The dollar is going to suffer. There is no forethought with these people. They have no idea what is happening.
First up, the elderly. About 2/3 of nursing home residents rely on Medicaid to cover their care. So when funding gets cut, nursing homes close, staff gets laid off, and grandma isn't staying in her bed anymore. And trust me, freedom doesn't tuck you in at night.
If you think that these massive cuts to Medicaid aren't going to affect you, I'm going to break down exactly why they are going to affect every single person in the United States, even if you're not on Medicaid. What Medicaid predominantly does, both for adults and children, is help with preventative medicine. So essentially they're able to see their pediatricians or their PCPs and able to get medications that keep them out of the hospital. If we suddenly prevent 7.8 million people in getting these preventive things that they need to keep them out of the hospital, our hospitals are going to explode. We're going to have people from all different backgrounds who need to be in the hospital who can't be. We absolutely don't have the resources for this. You're going to see worsening preventive health care for both children and adults. You're going to see emergency department rooms fill up and longer wait times. You're going to see hospital stays be prolonged because we can't discharge anyone on preventive medications because they're all too expensive and out of pocket. And in the end, we're going to see sicker people across the board.
Then there are children. 40% of American kids, 40%, get health care through Medicaid or CHIP. That means checkups, vaccines, asthma medicine. Cuts here don't just hit wallets, they hit classrooms. Sick kids don't learn. Hungry kids don't grow. Next, the disabled community. Medicaid funds home and community-based services that help people live outside of institutions. Cut that, and families are left holding the bag. Parents quit jobs to become full-time caregivers, households collapse, and people lose independence overnight. And here's the kicker, the working poor. Millions of Americans who clock in every single day, stocking shelves, driving Ubers, caring for your relatives in nursing homes, already rely on Medicaid. These cuts shove them out. You think they're lazy? No, they're exhausted, underpaid, and now uninsured. And don't forget veterans. Sure, the VA exists, but it's Medicaid that fills in the gaps, especially for long-term care and mental health. Slashing Medicaid is like pulling the rug out from under the very people politicians love to use as backdrops for campaign ads. So yeah, this isn't just about them. It's about your neighbor, your coworker, your grandma, your kid's classmate. Medicaid is woven into the fabric of American life, and when you cut it, you don't just unravel a program, you unravel families. But hey, at least some folks get to brag about owning the libs, right? Until the bill comes due, and it will. Now, before we wrap this up, I want us to take a quick look at something. The people who voted for the politicians pushing this bill, and how those very policies are coming back to smack them in the face. And listen, this isn't about dunking on anybody. I'm not here to say, ha, told you so. What I am saying is, if the folks who cheered the loudest are now struggling the hardest, maybe, just maybe, that tells us something about what's really inside this so-called big, beautiful bill. So let's roll a few clips. Watch closely because this is the part where the campaign slogans fade and the reality check kicks in.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we're going to do.
Well, I just spoke to my mother who's in the nursing home. You know, she and my family have told me for the past 10 years to keep my mouth shut and to not offend people with my, political views, because my political views are let's take care of people. Let's not be assholes. And let's not lie about facts.
Now look, some of these situations, folks should have never been in them to begin with. But oh well, elections have consequences. And the thing about consequences is they don't stay in one lane. We're all driving through them now. And if you're still sitting there thinking, but Glenn, these politicians care about us. They want to make America great again. I hate to break it to you, but no, they don't care. Not about you, not about your bills, not about your grandma's nursing home. So sorry to be the one to pop that bubble that somebody's got to do it.
Congresswoman, how can you assure the American people Medicaid won't be cut? Congressman, how can you assure the American people Medicaid won't be cut? Congressman, how can you assure the American people Medicaid won't be cut?
How can you assure your Nana that you still support her after she told you that chocolate milk does not come from brown cows? How can you assure your Nana that you still support her after
Keep
she told you
your damn mouth shut. Just shut up.
Young, healthy, vibrant, and you can work. We have 9 to 10 million jobs open right now. And there's going to be more than that because President Trump's sending all these illegals back. And so a lot of them just don't want to work. We can't be paying their Medicaid. We can't be giving them SNAP cards. We got to take care of the people that need to be taken care of. Got a lot of freeloaders in this country. And so what they've done, they've turned into socialists. They start living off the government.
You know what's crazy? Folks love to say, people just want to live off the government. Last time I checked, it's half the people in government who are living off the taxpayers. Funny how that works, huh? But hey, what do I know? I'm just Glenn, a guy in a studio running on way too much caffeine, trying to make sense of this circus we call a country. If you made it this far, do me a favor, hit that subscribe button, not because it fixes the healthcare system, trust me, I wish it did, but because it helps us keep pulling the curtain back on the nonsense. And around here, we think out loud. Together.
They say, how could you support the big, beautiful bill? Oh, I don't know, Karen. Maybe because this is exactly what I voted for. Putting more money back into the pockets of hardworking Americans.
Did you guys see that woman talking about her father getting kicked out of the nursing home? Well, apparently the nursing homes are kicking out their Medicare patients. And she was like, why would they do that? And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill.
Barack Obama, they expanded Medicaid to young, healthy adults. And so what the House has done, which I've been advocating for a long time, is if you're a young, healthy adult, you should be working and you shouldn't be getting Medicaid and sitting.
Ladies and gentlemen, welcome to the American circus. We've got the beer lady toasting to liberal tears. We've got the tough guy politician patting himself on the back. And meanwhile, we've got actual families watching their safety net vanish like it's some magic trick. Now, here's the part that makes my blood pressure spike. A lot of people cheering for these Medicaid cuts. They don't even realize they're on Medicaid themselves.
The only people who are losing Medicaid are the people who are working less than 80 hours per month, who are fully able to go to work every day, who don't have any dependents.
Look what I got. I got some liberal tears. Oh man, I'm ready. Ooh, liberal tears, baby.
Absolutely disgusting, by the way.
I almost puked, but let me stay focused.